This is on. Can you guys hear me okay? My name's Constantine George. I'm a native of Las Vegas, grew up here, and I'm proud to have you guys here in our city. So as a native of Las Vegas, growing up in the hospitality capital of the world, I have over 20 years of practice experience, noted that there's a lack of service excellence in healthcare. So because of that, that's why we're here today to have this talk. I am the founder of Epitome Medical. It's a primary concierge medical facility for internal medicine and pediatrics in Las Vegas. We're the first of its kind, and I'm also the founder of the VDS app, the first luxury house call app in the Las Vegas market as well. And having found these companies, I found them on 5 core principles, one of which is hospitality that we'll talk about today, the other 4 being humility, integrity, accountability, and respect basically as well. So having the 20 years of experience under my belt doing these companies with those core values, we came up with the Association of Hospitality and Healthcare. And that organization, the point of it is we strive to perfect the overall healthcare experience, and the association is based in the ideals of the hospitality principles. That's what we're looking for, and that's what we want to incorporate into healthcare. So looking at this slide, before I go to the next slide, question for you guys. When I bring up the word hospitality, what terms come to mind from all of you? What other synonymous words do you guys think of with a raise of hands? Any ideas?
Friendliness.
Friendly. What else?
Accommodating.
Got it. What else?
Service.
Got it. What else? Yep. So these are the terms that people mostly relate to hospitality. So we hear about these all of the time. And so you can see all of them listed up there. If you go to the basic definition of the word hospitality, it's the hospitable treatment, reception, or disposition. And the other definition is the activity of business of providing services to guests, irregardless of what location they're currently located at. If you take it a step further, the definition of hospitable, given a generous and cordial reception of guests. And so looking at those words, we go to the next slide, which is the word hospital. If you look at the word hospital, it comes from the Latin hospice, and the English words that we use on a daily basis, hospital, hostel, hotel, and hospital, they all have the same meaning, a guest or a visitor. So at the end of the day, the root words are all guests and visitors. That's where it comes from. So they are related, whether it's hospitality or healthcare. In a hospital, there is an association between the two, yet we haven't made that association in daily practice, whether it's a primary care office or in the hospital settings as well. So when it comes to healthcare, those words that I mentioned before, when it comes to hospitality, people don't think of those words. They tend to think of these descriptors when it comes to healthcare, and it's a 180 difference of what we would expect delivering services to patients, which are considered our guests and our practices. So how many of you with a raise of hands would agree with this slide when it comes to asking the general patient how to describe healthcare? These are the terms that people will describe because this is how they feel, whereas before, when I brought up the word hospitality, it was 180 different from what this shows. So the point of this is there's a big disconnect between hospitality and healthcare. Although the root words are the same, they come from the same root Latin word, there's a big disconnect. And so because of that disconnect and having been in practice for 20 years, that's where this Association of Hospitality and Healthcare was born from. Our goal is to make it so when you hear the word hospitality and you hear the word healthcare, you're going to use the same descriptive terms, not the 180 difference that we just saw in earlier slides. So the goal is, at the end of the day, hospitality-infused healthcare. When it comes to other industries outside of the healthcare industry that incorporate hospitality into their delivery of service, what industries come to mind? Just raise your hands and tell me what other industries do you connect when you use the word hospitality? Obviously the hotel industry, we're the capital of the world for that here. What other industries do you associate with hospitality? Any ideas? Restaurant, what else? Spas, what else? Travel. Correct. So next slide, these are all the industries that when you tell the layperson or a patient about hospitality, that is associated in all these sectors. We are the only service line or industry that has not done a great job at all in regards to incorporating hospitality into healthcare. We have failed tremendously, and it's a shame, but we continue to kind of do this, and we have to put an end to it and educate from the ground up, healthcare workers, how do we incorporate this? All other industries do this very well. They promote it, they act upon it. So keeping that in mind, what I tell patients is healthcare and hospitality are universal terms. It doesn't matter what language you speak, what country you live in, they're world known, they're global concepts. So when it comes to the global concept of hospitality, it doesn't matter what language you speak, every culture has their own word to describe what hospitality means. So again, it is a global concept. When it comes to healthcare, from my perspective as a primary care provider, what I tell people is this humanity of medicine. When I have a patient and they have high blood pressure, they have diabetes, they have cholesterol, they have coronary artery disease, those diseases don't really look at the patient in regards to where they're from, what color their skin is, what religion they are, what language they speak. Medicine is medicine. It affects us as humans, whether you're male or female. So there's that big discrepancy between what we perceive to be hospitality and healthcare and what the reality is. And so what I tell patients is there's this symbiosis that must occur between hospitality and healthcare. It's what we call in our company the check-in and check-out process. I'll give you an example. You guys came here for the convention, and I'm going to use that as an example in me having my patients come to my office. So my patients have to book an appointment. You, as clients at the hotel at the Mirage, you had to make a reservation to get here. On day of coming to the convention, you had to, as a patient, go to my front office, talk to my receptionist, give them your insurance card, your credit card, we collect your copay. When you checked into the Mirage, you had to give them your ID, a credit card on file, confirming your reservation as well. Same concept, just different industry. In my office, once you check in, the medical assistant will bring you back, they will do vital signs, they will triage you, they will take you into the exam room. When you're done checking in here at the hotel, the bellman, as an example, will allow you with your luggage to be escorted to your exam room, which is your hotel room. So again, the same principles apply regardless of what industry you're in. Upon checkout from my exam room, the patients are taken to the front office, to the checkout area, so they can book their next appointment. We can kind of finalize and wrap up their care for that date. Same concept when you guys leave the hotel. You go downstairs, you check out, you pay all your ancillary bills that were accumulated, and the hotel normally will follow up with you in regards to promotions, coupons, and such, just like we follow up with patients in regards to, did you follow up with your mammography visit? Did you follow up with your cardiologist? So that's that whole check-in and check-out concept. It applies to all industries. Automotive industry, you go to purchase a car, from the time you walk in, you're greeted, you're walked through the process, you're escorted out with your new car. So every industry does this. We have failed at doing that. Hence why we've come up with this Association of Hospitality and Healthcare to promote this symbiosis that has for a long time and too long been a big major disconnect. So our mission at the end of the day is to merge hospitality into healthcare, and by doing that, we need to start at the ground level, which is our education system through medical schools, PA schools, and nurse practitioner schools. And those 5 core principles that I based my original companies on for over the past 20 years, humility, hospitality, respect, integrity, and accountability, still apply. And so that is what our mission is to start ground level up and incorporate what Las Vegas is known for, hospitality, but into the general realm of healthcare, which I think we've not done a good job as of yet. We have these conventions, we talk about artificial intelligence, information, data, yet at the end of the day, we forget that patients are the center of the healthcare world, because if it wasn't for the patient, none of us would exist. Our industry would not exist at all whatsoever. So I thank you very much for your time, and if you have any questions, let me know. Anybody have any questions at all? Thank you very much for your time. Safe travels back home.